Come back to Monthly Mastery Week 3. This week's focus is clinical evidence, how it's generated, how to read an article, and then how to leverage the article in a clinical conversation. The learning objectives for today are: we will learn the different levels of evidence and how data from each level is used in the decision-making process. All innovation and disruptive technology navigate a similar adoption pathway. Innovators like Dr. Oliviers and Shada see the value in a new technology and develop reproducible workflows. The next step for a new technology to cross the chasm is to prove clinical superiority or demonstrates clinical equivalence with significant secondary benefits. For example, when comparing an open prostatectomy to a robotic prostatectomy, the oncologic outcomes are the same. However, robotic prostatectomy brings significant downstream benefits like reduced length of stay, reduced complication rates, increased sexual function, the list goes on and on. As Focal 1 HIFU becomes more and more accepted within the urologic oncology community, our next group of adopters will require more clinical evidence that compels them into action. Let's start with the basics. Generally speaking, there are two main types of academic research data: qualitative and quantitative. Qualitative is based more on experiences or feelings. For example, polling people on how they feel on a particular issue or studying how patients felt after a particular treatment alone. Quantitative studies are based more on hard data, such as looking at a patient's blood pressure before and after treatment. Levels of evidence, sometimes called hierarchy of evidence, are assigned to studies based on the methodological quality of their design, validity, and applicability to patient care. These decisions gives the grade, or strength, of recommendation. The levels of evidence pyramid provides a way to visualize both the quality of evidence and the amount of evidence available. For example, systematic reviews are at the top of the pyramid, meaning they are both the highest level of evidence and the least common. As you go down the pyramid, the amount of evidence will increase as the quality of the evidence decreases. The pyramid is also split between filtered and unfiltered evidence. Filtered and unfiltered resources differ in the level of evaluation applied to the works reviewed and the transparency of the authors regarding their evaluation methods, criteria for inclusion of articles, search strategies, and conflicts of interest of the review team members. The higher you go on the evidence pyramid, the higher the level of filtering and the greater one's confidence can be in the strength and quality of the recommendations. Systematic review and meta-analysis. A systematic review synthesizes the results from available studies of a particular health topic, answering a specific research question by collecting and evaluating all research evidence that fits the reviewer's selection criteria. Systematic reviews can include meta-analyses in which statistical methods are applied to evaluate and synthesize quantitative results from multiple studies. Randomized controlled trial (RCT). A randomized controlled trial is a prospective study that measures the efficacy of an intervention or treatment. Subjects are randomly assigned to either an experimental group or a control group. The control group receives a placebo or sham intervention, while the experimental group receives the intervention being studied. Randomizing subjects is effective at removing bias, thus increasing the validity of the research. RCTs are frequently blinded so that neither the subjects, single-blind, nor the clinicians, double-blind, nor the researchers, triple-blind, know in which group the subjects are placed. 4. A cohort study is a type of observational study, meaning that no intervention is taken among the subjects. It is also a type of longitudinal study in which research subjects are followed over a period of time. 5. A cohort study can be either prospective, which collects new data over time, or retrospective, which uses previously acquired data or medical records. This type of study examines a group of people who share a common trait or exposure and are assessed based on whether they develop an outcome of interest. An example of a prospective cohort study is a study that determines which subjects smoke and then many years later assesses the incidence of lung cancer in both smokers and non-smokers. Case control study. A case control study is another type of observational study. It is also a type of retrospective study that looks back in time to assess information. A case control study compares people who have the specified condition or outcome being studied, known as cases, with people who do not have the condition or outcome, known as controls. 6. An example of a case control study is a study that assesses the lifetime smoking exposure of patients with and without lung cancer. Case series and reports. A case report is a detailed report of the presentation, diagnosis, treatment response, and follow-up after treatment of an individual patient. A case series is a group of case reports involving patients who share similar characteristics. A case series is observational and can be conducted either retrospectively or prospectively. This concludes on module on the hierarchy of evidence and types of clinical papers that are used in the community. Later this week, we will learn to read and summarize a clinical paper,